పోడియాట్రీ అనేది ఇప్పుడున్న సొసైటీలో ఎంతమందికి దీని గురించి అవేర్నెస్ ఉందంటారు?
Podiatry is something which now the medical science, which now the society, which now the government, everybody has to look into it.
Hi, hello everyone. I myself, Dr. Moana. So today I'm here at Advanced Wound Healing Clinics at Musarambag, close by to metro station. So today we have Dr. KVNN Santosh Murthy garu, who's podiatric and burn surgeon specialist. So hello sir.
Hello.
ఫస్ట్ ఆఫ్ ఆల్ థ్యాంక్ యూ సో మచ్. మీరు ఇంత బిజీ స్కెడ్యూల్లో కూడా నా మెట్ టాక్కి టైం ఇచ్చినందుకు ఐఎమ్ వెరీ థ్యాంక్ఫుల్ టు యూ.
Thank you. It's an opportunity to have a talk with you.
థ్యాంక్ యూ సార్. సో ఇప్పుడు ఈ పోడియాట్రీ అనేది ఇప్పుడున్న సొసైటీలో ఎంతమందికి దీని గురించి అవేర్నెస్ ఉందంటారు? డూ దే రియలీ హ్యావ్ ఎనీ ప్రాపర్ పిక్చర్ వాట్ ఎగ్జాక్ట్లీ ద పోడియాట్రీ ఈస్?
Podiatry is something which now the medical science, which now the society, which now the government, everybody has to look into it. The reason because the statistics are so bad. What statistics? We all know for every 1 second there is a birth, right? Every 2 seconds there is a death, and every 30 seconds there is an amputation. Coming to India, every year more than 1 lakh amputations are happening. 1 lakh amputations, 1 lakh families are getting affected every year, which is increasing at an alarming rate of 13.5% every year. When it comes to our Andhra Telangana states, almost at an average of 300 to 500 amputations are happening every month.
So coming to this point, first of all, I'm glad to mention that you framed an association, right? That Indian Podiatric Association.
Yes.
And then I'm happy to know that you are the president leading the association. So
Ma'am, our association, Indian Podiatry Association, was started by the founder president Dr. APS Suri. He is in Delhi, and he's my mentor. And that's how Indian Podiatry Association was never in the South Indian part. And I was the first one who came to, who brought this association to South India. And Telangana and Andhra states I was leading as a president from the past 5 years. And in these 5 years, we have done tremendous activities. We have yearly national conferences happening, and every month we have gathering of the local doctors and all, and we discuss about the latest updates coming. And we select every month one district where we select some doctor who will be working on this, who will be interested in podiatry, and we train him, and we do conduct some workshops at his place so that the awareness is spread around. So all these things we need to do, because to prevent amputations and to make Telangana an amputation free state, we should start working from the root level.
So doctor, as you mentioned that Indian Podiatric Association, so e association dwara what are you trying to gain? I mean, like, what are you trying to present to the society?
Ma'am, as I mentioned you, like Indian Podiatry Association, we are going into the districts, we are training the doctors, creating an awareness, and the local media is getting covered. So in that way, we are trying to create an awareness about diabetic foods, because diabetic foods, 80% of these can be prevented. Means 80% amputations are preventable. So if we have a proper awareness and early the better, early diagnosis, early detection, then 80% of amputations are preventable. This is the service we are giving to the society. And all these amputation starts from districts and village levels. So there, if we have trained people under our association and they do the basic things properly, they should know when to refer and when not to refer.
So considering this association, do you have any target audience and occupation?
Now I'll tell you, the uniqueness about our association is that you have surgeons association, you heard of it, right?
Yeah.
You have dental associations, right? You have physicians association, okay? You have orthopedic associations.
Yeah.
vascular, plastic. Everybody has their own associations, but Indian Podiatry Association is one of its kind where everybody is included in this.
Oh, so all the departments are into.
Yes, because preventing diabetic foot is a multimodality approach. It's not a one man's job. Okay,
Yeah.
alone a podiatric surgeon cannot do everything. Okay, so for along with me, we have vascular surgeons. They have their own role. Plastic surgeons have their own role. Physicians, diabetologists, physiotherapists have their own role to play in this. So preventing a diabetic from getting amputated, so many hands have to be working.
Yeah.
That's the reason in our association we have everybody. So in other association, like it's the same category of people, but here because everybody's having their own role to play, we don't have ego clashes, and we all will be working together for a common goal. That is the whole idea.
That's so kind of you. So, as you said, there are like many other departments involved in this association. On being the president of this Indian Podiatry Association, how do you feel? Like, what are your views on being a president of this association?
It's a very highly respectable and highly responsible job at the same time. Okay, responsibility is huge because we are creating awareness. We're not just sitting in the seat and enjoying the post. We need to go to the public, and this is a medium which I have chosen so that I can reach to the ground level. And through the association, the more number of people are attaching to the Meads district, that gives a job satisfaction at the end of the day. Okay, today we could prevent some legs from getting amputated. So it's like that.
So, do you frequently conduct camps addressing this association or?
Yes, of course. We have yearly meetings,
Okay.
yearly annual. Now the next annual conference this year gonna come up in Hyderabad itself. And every month we have any newer product which is coming into the market regarding wound healing, or a newer dressings, or a newer devices which is helping us in detecting the problem early. All those things. So anything new coming into the market, it will be first introduced in our association, and the knowledge will be shared among all of us, so that we give a better quality treatment each time.
So, thank you so much, doctor, for letting us know more about your Indian Podiatry Association, wherein like too many branches and too many different medical fields are involved, wherein
Yeah.
everyone working together to prevent this diabetic foot amputations, which plays a key role in the life of a common man, because that the breadwinner of the family, if is amputated because of this diabetic foot, it's a huge loss for the
Yes,
family.
of course.
So
One member of the family is affected means
the entire
the
family
entire
is
family is
affected.
affected. So it's the whole family is getting amputated
That's
psychologically.
a great noble work I can say from this Podiatry Association,
And
and
now we are even teaming up with the Telangana government so that we can have multiple centers in the PHC level where early detection of the problem can happen. Because diabetic foods, it is said that patients will start with neuropathy.
it's
So
so
neuropathy means they don't have the sensation. When they
yeah.
don't have the sensation, there is a saying that diabetic foods walk till death.
It's so great to know that you're putting in like you're involving the government officials also to
Yes.
provide with the needful support and all. Uh, it's a great move. It's great move from your association, and being a president of it, I know it's a huge responsibility
Yes,
on
of
you.
course.
And thank you so much, sir, for knowing us about this Indian Podiatry Association. So, as in we said, this association is all about the diabetic foot. What exactly is this diabetic foot? I mean, the podiatry. What is it actually?
Podia means foot.
Yeah. Okay.
Like I've already said, the statistics. Okay. So statistics wise, every month 300, 400 amputations, 300, 400 families are getting affected. So we need to prevent that. Okay. So how we're gonna prevent it? Almost 80% are preventable. So how are you gonna prevent them? It is very simple. Is having a basic awareness about your feet. మనం పొద్దున్న లేవగానే మొహం అద్దంలో చూసుకుంటాం, బట్ డయాబెటిక్ పేషెంట్ కాళ్ళు అద్దంలో చూసుకోవాలి. Because he loses his sensation, he doesn't know what is happening in his feet till some foul smell comes, till some wound which is bleeding happens. He doesn't have the sensation.
సో ఈ డయాబెటిక్ ఫుట్ అనేది ఇనిషియల్గా ఎలా స్టార్ట్ అవుతుంది? లెట్స్ సే ఆ డయాబెటిక్ పేషెంట్ దీన్ని ఎలా గుర్తించవచ్చు ఇనిషియల్గా? వాట్ ఆర్ ద ఎర్లీయెస్ట్ సైన్స్?
Earliest signs, ma'am, first thing is Neuropathy.
Okay. Neuropathy.
Neuropathy. It will happen. So why it is happening, I'll tell you. See, any part of the body will have a good vascularity, right? సో ఆ పార్ట్ ఆఫ్ ద బాడీకి మన వాస్కులారిటీ బాగుంటుంది కాబట్టి అక్కడ బ్లడ్ సప్లై బాగుంటుంది కాబట్టి అక్కడ మనకు ప్రాబ్లం అనేది రాదు. ఒకవేళ ప్రాబ్లం వచ్చినా దాన్ని సర్జికల్గానో మెడికల్గానో రెక్టిఫై చేయగలుగుతాం, రైట్? కానీ డయాబెటిక్ ఫుడ్లో ఏంటంటే అక్కడ బ్లడ్ సప్లై లేదు. సో బ్లడ్ ద్వారా రావాల్సిన ఏది అక్కడ రీచ్ కాదు. మీరు ఇచ్చిన మెడిసిన్స్ రీచ్ కావు, మీరు ఇచ్చిన డైట్ రీచ్ కాదు, మీరు పీల్చుకున్న ఆక్సిజన్ రీచ్ కాదు. So ultimately what is happening, which is going into necrosis and death. That's called gangrene. Okay. మీరు సర్జరీ చేసినా అది అక్కడితో ఆగదు. లైక్ యూ డూ a proper debridement, you exercise all the dead tissues, all the necrotic tissues remove. But then మళ్ళీ గ్యాంగ్రీన్ డెవలప్ అవుతుంది బికాస్ బ్లడ్ సప్లై లేదు. రక్త సరఫరా బాగున్నప్పుడు సర్జరీ చేస్తే అది యాంపుటేషన్ కాకుండా ఆగుతుంది. రక్త సరఫరా లేనప్పుడు సర్జరీ చేస్తే అది ఖచ్చితంగా ఇంకా గ్యాంగ్రీన్ అయిపోతుంది. That's how the diabetic foods keep on amputations and they lose their upper limb, lower limb, everything.
సో డయాబెటిక్ ఫుడ్ అని మాత్రమే ఎందుకంటారు? ఇప్పుడు డయాబెటీస్ ఉన్న వాళ్ళలో ఆ గ్యాంగ్రీన్ అనేది వేరే ఏ బాడీ పార్ట్లో కనిపించదంటారా?
The main reason is మనం పుట్టినప్పటి నుంచి చనిపోయే వరకు మనకు కూడా లైఫ్ జర్నీలో వచ్చేది మన కాళ్ళే, రైట్? సో మీ బాడీ వీక్ అయిపోయినా మీకు ఫరక్ పడదు, కానీ మీ కాళ్ళు వీక్ అయిపోతే హోల్ బాడీకి ఫరక్ అవుతుంది,
చాలా చాలా ఇంపాక్ట్ ఉంటుంది,
రైట్? సో డయాబెటిక్ ఫుడ్లో ఏం జరుగుతుంది, బ్లడ్ సర్క్యులేషన్ తగ్గుతుంది. బేసిక్గా డయాబెటీస్లో జరిగేది అది. వాట్ డస్ డయాబెటీస్ డూ? షుగర్ అనేది ఏంటి? షుగర్ తత్వం ఏంటి? పేరుకోవడం దాని తత్వం. షుగర్ ఏం చేస్తుంది? పేరుకుంటుంది. ఫర్ ఎగ్జాంపుల్ ఇప్పుడు కిచెన్లో షుగర్ ఉంది, ఓకే. షుగర్ మామూలుగా ఉంటే ఏం కాదు, కానీ దాని మీద ఒక చుక్క నీరు పోస్తే ఏమవుతుంది? కరిగిపోయి గట్టిగా అవుతుంది, రైట్? అలాగే మన బాడీలో కూడా షుగర్ ఉంటే ఏమి కాదు, ఎందుకంటే షుగర్ ఏం చేస్తుంది? పేరుకుంటుంది. కానీ పేరుకున్న షుగర్ గట్టిగా అయిపోయినప్పుడే మనకు ప్రాబ్లం.
సో దానికి
ఎక్కడ గట్టి పడుతుంది? అది బ్లడ్ వెజల్స్లో గట్టి పడుతుంది. దానివల్ల బ్లడ్ వెజల్స్ బ్లాక్ అయిపోతున్నాయి. బ్లడ్ వెజల్స్ బ్లాక్ అయిపోవడం వలన సరైన న్యూట్రిషన్ ఆ పర్టికులర్ భాగానికి అందదు. ఇది హెయిర్ నుంచి నెయిల్స్ వరకు అన్ని ప్లేసెస్ జరుగుతాయి, కానీ కాళ్ళలోనే ఎందుకు ఎఫెక్ట్ ఫస్ట్ కనిపిస్తుంది అంటే, ఎందుకంటే ఫుట్ ఆర్ ద వెయిట్ బేరింగ్ రీజన్. ఇట్ ఈస్ బేరింగ్ ద హోల్ వెయిట్ ఆఫ్ యూర్ బాడీ. ఫుట్లో బ్లడ్ సప్లై తగ్గిపోయింది అంటే ఫుట్లో బోన్స్, మజిల్స్, టెండన్స్, స్కిన్, ఫ్యాట్, ఎవ్రీథింగ్ ఈజ్ లూజింగ్ ఇట్స్ బ్లడ్ సప్లై, లూజింగ్ ఇట్స్ న్యూట్రిషన్, బట్ స్టిల్ ద సేమ్ 100 kgs వెయిట్ ఇట్ ఈస్ బేరింగ్. సో అందుకనే ఫుట్లో ప్రాబ్లం ఫస్ట్ కనిపిస్తుంది. మీకు హార్ట్లో ప్రాబ్లం ఉండొచ్చు, కిడ్నీలో ఉండొచ్చు, ఎక్కడే బ్రెయిన్లో అన్ని చోట్ల ఉండొచ్చు, బట్ నన్ ఆఫ్ ద పార్ట్స్ ఆఫ్ యువర్ బాడీ ఆర్ బేరింగ్ వెయిట్.
సో ట్రామా అనేది విల్ బి an add-on factor to this? దెబ్బ తగలడం కానీ ఏదైనా చిన్న ఇంజరీ కానీ
see always there is a supply demand issue, ma'am, we need to understand. Okay, కాళ్ళల్లో బ్లడ్ సప్లై బాగున్నప్పుడు నీకు యాక్సిడెంట్ అయినా దెబ్బ తగిలినా నీకు షుగర్ ఉన్నా కూడా అది మానిపోతుంది. అదే కాళ్ళలో దెబ్బ తగిలింది, ఆ టైంలో మీ పాదాల్లో రక్త సరఫరా సరిగ్గా లేదు, ఏమవుతుంది? ఇట్ విల్ ఎండ్ అప్ ఇంటూ గ్యాంగ్రీన్.
సో ఈ గ్యాంగ్రీన్ కి స్టేజెస్ అంటూ ఉంటాయా డాక్టర్? లైక్
there are multiple stages of gangrene. Okay, so gangrene stages is something which is not important now, because to create awareness to the public who are watching this video, I want them to understand what is the first thing that they need to see. Blindfoldedly, ma'am, now I'll tell you, if sugar, అందరు ఏమనుకుంటారంటే డయాబెటిక్ ఫుడ్ అని డయాబెటీస్ అని ఒక పేరు పడిపోయింది దానికి. సో షుగర్ వలన ఫుడ్ ప్రాబ్లమ్ అని ఫిక్స్ అయిపోయారు, బట్ ఐడియల్లీ ఇట్స్ నాట్ లైక్ దట్. ఓకే, షుగర్ వలన ప్రాబ్లం అయితే 10 మంది షుగర్ పేషెంట్స్లో 10 మందికి కాళ్ళ సమస్యలు రావాలి, కానీ రేషియో ప్రకారం 10 మందిలో 3 మాత్రమే కాళ్ళ సమస్యలు వస్తున్నాయి. ఆ 3లో ఒక్కళ్ళకి మాత్రమే వేళ్ళలో కాళ్ళు కొట్టేసే పరిస్థితి వస్తుంది, రైట్? మిగతా 7 అయితే బాగున్నారుగా. ఇప్పుడు మా అమ్మమ్మ ఉంది, తను 40 years నుంచి డయాబెటిక్, హర్ ఏజ్ ఇస్ 92. ఈరోజు వరకు కాలు గోరు కూడా పోలేదు. ఇట్ మీన్స్ షుగర్ ఈజ్ నాట్ ది కల్ప్రిట్ అలోన్.
Okay, so there are many
Along
add-on
with, yes,
factors.
exactly. Along with diabetes, if you have vitamin C deficiencies, iron deficiencies, vitamin D deficiencies, okay, you have smoker, you're an alcoholic, you have lifestyle issues.
So, are there any ways wherein we can detect this earlier? Investigations కానీ లేకపోతే
There are hundreds of investigations, ma'am.
okay.
Okay, you go to a doctor, they will do all the investigations, but we are scared of getting investigations done. So we need to understand that the sugar which is in your body, okay, it's there from the past 10 years, it is there from the past 15 years, and along with that you have lifestyle issues. You should keep it in your mind that yes, somewhere there is a blood circulation which is getting going to get blocked soon.
So
ఫర్ ఎగ్జాంపుల్ ఐ టెల్ యూ, ఫర్ ఎగ్జాంపుల్ ఇప్పుడు కిచెన్లో మనకి వాటర్ వస్తుంది ట్యాప్లో, ఓకే, వాటర్ వస్తుంది, మనం యూజ్ చేసుకుంటాం. సడన్గా వన్ డే ఫైన్ మార్నింగ్ మనం ట్యాప్ ఓపెన్ చేస్తే నీళ్ళు రావట్లేదు. ఎందుకు రావట్లేదు అని ప్లంబర్ని పిలుస్తాం. ప్లంబర్ వచ్చి చెక్ చేసి మొత్తం పైప్ లైన్ జామ్ అయింది సార్ అంటారు. ఒక్కరోజులో అయిందా? అది కాదు కదా.
gradually.
ఎగ్జాక్ట్లీ. సో షుగర్ విత్ కొలెస్ట్రాల్, విత్ విటమిన్ డి డెఫిషియన్సీస్, ఐరన్ డెఫిషియన్సీస్, స్మోకింగ్, ఆల్కహాల్, లైఫ్ స్టైల్ ఇష్యూస్, ఇవన్నీ పక్కన పెడితే స్ట్రెస్, ఇవన్నీ లాంగ్ టర్మ్గా ఉన్నప్పుడు ఏం జరుగుతుంది అంటే మెల్లమెల్లగా పైప్ లైన్స్ బ్లాక్ అవుతూ ఉంటాయి.
That's like a slow poison.
అండ్ బాడీ ఈజ్ ఆల్వేస్ ట్రైంగ్ టు కాంపన్సేట్.
Yeah.
That is the reason the problem doesn't come out. But by the time the problem is coming out, it's already too late.
Okay.
So you should not wait for any warning signs. It is, you should understand that when you are diabetic, with such kind of environment which you are staying, you have adulterated food, you have impure water, even the air which you are breathing is not healthy air, which is lacking oxygen. In that condition, you are bound to get diseases.
So as you mentioned, lacking oxygen. I heard there are some specific oxygen therapies to treat these conditions, right?
Exactly. Yes, very true. So we need to understand that oxygen is life. You accept that?
Oh, of course.
84 లక్షల జీవరాశులు ఉన్నాయి భూమి మీద, 84 lakh species.
Yeah.
Right? And 1,000 crores of population across the world. We're all living on this oxygen, which is only 20% in the air. Right? So oxygen is life. You may have like 5 liters of blood, okay, and but even for 5 minutes, if you stop breathing, you'll die.
So till now we spoke about podiatry, and then what exactly is this podiatry, and then so amazed to know that there is an association addressing this podiatry, working on this, and then creating an awareness among the people, dani diagnosis enti, treatment plans enti, and the support from the government in enlightening everyone about the podiatry and the complications, and then early diagnosis importance enti. Of course, it's going to play a very key role in every family, because one person affected in the family with a podiatry, I mean this diabetic foot, eventually leading into amputation or any other worse consequence. So it's going to have an impact, a very huge impact on the entire family. So this is a great cause wherein this Indian Podiatry Association has come up addressing this thing and creating awareness and helping people, especially the common people who can't afford the treatment when the condition goes out of the hand. It's a great motive. So, ivanni pakkan peteste, coming to this advanced wound healing clinics. When I had this opportunity to do my Med Talk with Moana show, Dr. KVNN Santosh Murthy garto, I was just wondering, నేను కొంచెం గ్రౌండ్ వర్క్ చేయాల్సి వచ్చినప్పుడు I was like గూగుల్ చేస్తున్నప్పుడు వూండ్ కేర్ క్లినిక్స్ చూసాను, ఇంకా వేరు వేరే డయాబెటిక్ రిలేటెడ్ ఇష్యూస్ క్లినిక్స్ని చూసాను. కానీ ఈ వూండ్ హీలింగ్ అనేది నేను ఐఎమ్ ప్రిటీ ష్యూర్ ఎంటైర్ ఇండియాలో నేను ఈ టర్మినాలజీతో, ఈ నేమ్తో క్లినిక్ అయితే చూడలేదు. సో వాట్ ఈస్ సో స్పెషల్ అబౌట్ దిస్ వూండ్ హీలింగ్? వూండ్ కేర్కి వూండ్ హీలింగ్కి అసలు డిఫరెన్స్ ఏంటి? సో లెట్స్ గెట్ మోర్ ఇన్ డీటెయిల్ అబౌట్ దిస్. సో డాక్టర్, వాట్ ఈస్ సో స్పెషల్ అబౌట్ వూండ్ హీలింగ్?
Ma'am, the word healing itself is a very magical, right? So healing anedi, it's something which you are more it shows your confidence. Okay, healing is something which people are not sure about. That's the reason people go with care, wound care. It means they are not assured about wound healing. But when I say wound healing, I keep the name Advanced Wound Healing Clinics. It means I'm double sure that the kind of results I'm going to give.
So the wound is gonna heal for sure.
That's why it's Wound Healing Clinics. So,
That's an amazing thought.
because I'm basically a general surgeon. Okay, I did my general surgeries. I do my laparoscopic procedures. I'm an endoscopy trainer, and moreover, all these things I was doing quite well in my Nalgonda where I was first initially practicing. But then this is something which everybody is doing. Okay, there's nothing unique what Dr. KVNN is doing about. Okay, this is something which everybody is doing, but what I wanted to do is I wanted to do something for the society, and the most neglected part which I see in the medical field is wounds.
Yeah, like damn right, sir.
Yes, wounds are something which is the most neglected part, and nobody can assure whether the wounds are going to heal or not.
On being a dentist, on being into this medical profession, I myself haven't heard about anyone working on this podiatry or wound healing part.
Ma'am, it needs a lot of dedication and passion, ma'am. It's not easy because see, where you cannot assure, nobody wants to take any risk, and if nobody will take a risk, nobody will touch those patients. What will happen to those patients?
That's so kind motive of you to address this sort of thing and
I
then working
left
on
my
it.
general surgeries, I left the laparoscopies and endoscopies, and now I'm totally into wounds. Whether it is a small wound to the largest of the largest burns wounds.
Yeah, I just came across apart from podiatry, you are into burn management as well.
Because I see that suffering is something which I can't tolerate, ma'am. I can't see somebody suffering.
I know whose self-esteem has really come down because of those wounds and all, burns and
Yeah,
all.
because see, if a patient has burns, okay, so say 30-40% burns are there. The actual burns treatment is very expensive, okay. Along with that, the patient hospital stay and everything. Once the patient is recovered from the illness, once he's out of danger, his wounds take months together to heal. He will have a cutoff from the society because he himself cannot see in the mirror how he's going to face the society, with what confidence.
Yeah, that will have a great impact on their physical, mental, emotional,
Yes.
social connections, everything.
So burns is something which I thought like I need to work on.
That's an amazing move by you.
The number of burn centers in India are less.
Yeah.
And it is not so simple like, okay, I'm doing my general surgeries or I'm doing my plastic surgeries, I'll also focus on burns. It is not an option. I'm a general surgeon, I'm doing my general surgeries, okay. I'll also take care of diabetic foot wounds if they come to me. It's not an option. This is something which needs a special care and attention. You just do your regular thing, and this is just an add-on or just an option. Then the patient wound healing also becomes an optional.
Yeah. But that's a great move by you. Like,
I wanted to focus on this part, not as an option, as the prime focus. I left all the basics and general surgeries. I have my colleagues who are doing it, wonderful jobs they are doing. Let them do that. I'll focus on wounds.
so this clinic is all about
Wounds,
just the wound healing.
just wounds and nothing else. సో wounds కన్నట్టు మనకి ఒక గాయాలకు సంబంధించిన హాస్పిటల్ అని మనం ఎక్కడ వినలేదు.
అస్సలు లేదు సార్. నేను
ప్లాస్టిక్ సర్జరీ వాళ్ళు ప్లాస్టిక్ సర్జరీస్ చేస్తూ wounds చూస్తారు, గాయాలు చూస్తారు. వాస్కులర్ సర్జన్ వాస్కులరీస్ చేస్తూ గాయాలకు సంబంధించిన ట్రీట్మెంట్ ఇస్తారు. డయాబెటాలజిస్ట్, ఫిజిషియన్స్, ఆర్ఎంపీస్ దగ్గర నుంచి ప్రతి ఒక్కళ్ళు wounds ట్రీట్ చేస్తున్నారు. కానీ wounds కంటూ ప్రత్యేకమైన హాస్పిటల్ ఉందా అంటే లేదు. This is the first hospital which works only and only on wounds.
Yeah. I was so surprised to see that. నేను అన్ని చూస్తున్నప్పుడు there's no other clinic addressing as wound healing.
Yes.
Any other wherein like wounds and burns are a part of their treatment and part of their practice, but specifically wound healing అయితే ఇక్కడ చూడలేదు సార్.
Head to foot, any wound, we make sure that heals, provided it's not a cancer. I get patients who are having wounds from past 30-35 years. And still we can heal them. If you have the proper protocol, you can heal it like 45 days to 60 days. As per WHO guidelines, people think that the wound is healing, but actually it is not, because they don't know what is wound healing. WHO guidelines prakaram, any wound whether it is half centimeter, 1 centimeter in size, whatever may be the causative factor. Okay, whether it is half centimeter, 1 centimeter in size, whether it is 20, 30 centimeter size like in burns wounds, it doesn't matter. But any wound is there on the body, and if you have put a right protocol in it, in the first 4 weeks, 50% of the wound should heal, irrespective of the size and location.
Wherein starts a great prognosis, I can say.
Yes, 50% should heal in the first 4 weeks, and the next 8 weeks, the remaining 50%. So, the complete wound to wound closure should happen in 12 weeks. And if you're extending any way beyond in between, it means only two things are happening. Either డాక్టర్ ప్రోటోకాల్ అయినా రాంగ్ అయి ఉండాలి, లేదా పేషెంట్ అయినా డాక్టర్ చెప్పిన ప్రోటోకాల్ ఫాలో కాకపోయినా ఉండాలి. దట్స్ ఇట్. బట్ ఇఫ్ దెర్ ఇస్ అ డిలే, ఇట్ మీన్స్ యూ నీడ్ టు చేంజ్ యర్ ప్రోటోకాల్. మ్యామ్, దెర్ ఆర్ సో మెనీ అడ్వాన్సెస్ విచ్ ఆర్ కమ్ అప్. People are not knowing about the advances, or people think that it's too expensive.
But like as far as I know,
I'll give you a small example, ma'am, where I was really touched. Okay, when I was in Nalgonda, I was practicing. There was a lady who came to me whose leg was supposed to get amputated, right? And the lady's age was around 67, and her husband's age is 81.
Oh.
Who is her husband? He's a Moana who preaches namaz, Quran in the masjid. What is his salary? 6,000 hardly per month. Okay, that age he wants to save his wife from getting amputated. He brings her to me because somebody said that he is doing good work in wound healing. So the patient comes to me. Now her salary is 6,000, his salary, and the patient is suffering with pain. Her toes are supposed to get amputated, and she can't walk after that, because once an amputation starts, it's a never ending process, it keeps on happening.
Yeah.
It doesn't heal. The place where you ampute, you can't assure that it's gonna heal. That's the situation. So that patient came to me. I said, see, you have got peripheral artery disease, you don't have blood supply in your feet. The only way you can, and the patient was also having some cardiac issues, and some creatinine issues were also there. So there was high risk for her undergoing some vascular procedure. They were not affordable to go to Hyderabad, or they were not trusting the whole process.
Okay.
So they thought like, okay, they'll come to me, I will do something for the wound healing. I just said, it was an open, there's nothing hidden. I just told them, like, see, there is a severe peripheral artery disease, there is no blood supply in your feet, and the only way to get back your circulation will be through stem cell therapy, which is the latest advances. And the cost coming around like 2 to 3 lakhs rupees. But yes, how much is he earning? 6,000 per month. He can't afford, right? Ideally, what they will do, what we all think, they'll go to some government hospital, they'll chop off their feet.
Get the amputation done, and
after that they will become bedridden, and then because they are bedridden, their sugar levels will become high, because there is no mobility, her heart will become more weak. There is circulation issues, there is oxygenation issues, slowly multi-organ failure, and ultimately death within 6 to 8 months. This what happens. To my surprise, when I told about stem cell therapies, they trusted me. Some or the other way, within a span of 10 days, I could counsel around like 50 to 60 people of their community who are just coming regularly, talking to me and trying to understand, figure out why it is so expensive. Can we really do it? Can we trust the doctor? Will the results gonna come? Everybody have their own doubts. And yes, on the 11th they got their stem cell done, and after doing the stem cell therapy, the patient became all right. Within a span of 2 weeks, the patient could stand up and walk back on her feet.
Within 12 days?
2 weeks.
2 weeks.
So this happened. Now, when we say that advanced therapies are expensive, how could a person with 6,000 rupees salary could afford and do all these things? It means it is the importance, the value that you give to your person. You can suggest anybody to undergo an amputation, but will you be ready to go for an amputation when you have the same problem? It's easy to suggest for others.
So true.
A doctor can suggest go for an amputation. Will he do the same amputation for his father, or will search for newer advanced technology to save his father's feet from getting amputated, or his mother's feet from getting amputated?
Of course, he'll look for a new advances.
That's what. And And a person of 6,000 rupees salary per month can afford 2 to 3 lakhs rupees of injection and save his wife's feet from getting amputated. So, is really finances an issue here? No. So, it is always, I say, I believe this, that it is the patient's mindset which is poor. Patient is not poor.
So it depends on how the doctor handles the patient and educates them.
Yes, it is your importance. Husband loves her wife so much that he could afford what he can't afford, and he got the results also.
That's a great thing, actually.
So that's what. So advanced wound healing clinics, at here we have all the advances which are available in India under one roof. That is the whole idea about advanced wound healing clinics. It's not that stem cells are not available any other part of India. It's not that hyperbaric oxygen therapies are not available. It's not that customized footwear doesn't happen outside. But everything under one roof, this is the first of its kind where we can assure, because everything is under one roof, that yes, we can heal your wounds. That's how advanced wound healing clinics came under picture.
So, coming to this advanced wound healing clinics, so what are the advanced treatment options you provide?
Ma'am, from a limb from getting amputated, okay, preventing amputations is one segment, and even those feet who are not going to get amputated, even it means that they don't know if the problem has already started or not, even that can be detected. It means a normal feet, a diabetic, after 6 months if he's gonna get a disease or also, we can identify with our advanced technology.
Okay.
Okay, we have got foot analysis and gait analysis labs. Okay, with that we can identify in the next 6 months to 1 year whether he's going to develop an ulcer foot or not.
Okay.
That is one thing. Second, if he's already having a wound, we can make sure that the wound heals to that extent. That is one thing. Third thing, once the wound is healed, we'll make sure that it doesn't recur again. So we are working basically on three segments.
Okay.
I can make it more precise, like we are working on advanced wound healing clinics works on three aspects: restoration, rejuvenation, regeneration. RRR.
Yeah.
Right? Restoration. Whatever is deficient in the body, will refill it.
Okay.
So that further deficiencies, further issues are corrected. Rejuvenation. No cleaning, there is no healing. So first we detox and clean up the patient, colon hydrotherapies, infrared saunas, and all these things. So after that, once we detox the patient, after that when we give 100% oxygen into his body, their rejuvenation starts. When there is restoration and rejuvenation, won't there be regeneration?
Of course.
Yes. For
That's
regeneration, we have got stem cell therapies, we have got PRPs, fat graftings, dermal substitutes replacements, so many other things. These are all the latest things which we are offering. Everything is available in India, but at some other different corners. All under one roof, so we make sure the patient coming in wheelchair will make him walk back home. Amputation is a matter of 2 minutes, ma'am.
yeah.
But to keep the leg safe from amputation and making him walk back to his home, I need to work for at least 2 months on him, provided my protocols are right and patient follows the same. So preventing amputation, giving a better quality of life to the patients, that's where I can cut the sufferings. That's how advanced wound healing clinics came into the picture. I make sure that nothing is left, no stone is unturned from my patients to prevent his amputation.
So this advanced wound healing clinic works on 3 hours, right? All right. So we got to know ample information about how this advanced wound healing clinic works on. That is, the prime thing behind this clinic is 3 R's. That is restoration, rejuvenation, and regeneration. So to know more about all these 3 R's, stay tuned. Thank you.